Our top story tonight, Florida lawmakers head to Tallahassee for week 2 of their annual 60-day session, planning to take up one of the most important issues the state is dealing with this year, the ongoing opioid epidemic.
The Senate is considering a bill that would limit doctors' abilities to write opioid prescriptions. ABC 7's Jess Dowdrick joins us now to explain what changes lawmakers are looking at. Jess?
Scott, Jacqueline, this bill is looking to prevent patients from becoming addicts in the first place. A trend we're seeing now is what starts as a prescription for an opioid can lead to not only an addiction to that drug, but eventually an addiction to more deadly drugs like heroin.
People have been abusing opioids for centuries.
For the last 20 years, Dr. Eugene Pereira has been helping patients manage chronic pain.
It has always been thought that there are opioids and there are adjuncts or complementary medications. I like to have people consider the fact that opioids should be the adjuncts and not the mainstream of treatment of pain.
Before Dr. Pereira prescribes an opioid or any other prescription medication to a patient, they're given a urine and oral exam.
To make sure that, number one, they are taking the medications we are prescribing, so there's less of a chance of misuse or diversion. To make sure that they're not getting medications that we are not prescribing.
Soon, doctors in Dr. Pereira's field could be limited to prescribing no more than 3 days worth of opioids, or in cases of acute pain, a 7-day prescription. It's an effort that addiction treatment specialists say could stop what's described as accidental addicts.
Those individuals who have some risk behaviors but haven't really come forth with them, the doctor makes a prescription and it sets the ball rolling down the hill. That is a horrible experience for the individual.
First Step Vice President PJ Brooks feels like this could be a step in fighting the epidemic, but that it isn't even close to a cure-all.
We've actually done a pretty good job in the state of Florida of limiting access to prescription drugs. So now what's happened is we're really dealing with a heroin and fentanyl epidemic.
A part of this Senate bill would require doctors to check patients' prescription records before prescribing any opioids. Doctors would also have to take continuing education courses on prescribing the drugs.
Nowhere in my medical training did I get a detailed discussion of how to safely prescribe opioids. I don't think many of my peers did either.
Another major issue that lawmakers will take up this week is hurricanes. The State House will review 12 pages of information dealing with how the state responded before, during, and after Hurricane Irma. Some recommendations to deal with hurricanes better include extending a toll road from the Tampa Bay area to the Georgia border, also requiring all assisted living and nursing home facilities to have an emergency source of power.